So pressure ulcers um, are essentially um, injuries that are caused on soft tissue. Uh, this occurs when soft tissue is compressed over bony prominences, and this could happen if the patient is bedridden, if they're immobile, and there are certain spots throughout the body that this tends to occur a little bit more often than not. The ankles, the elbows, and shoulder blades, hips, and all in those areas are where the bony. It's more bony than anything. So, like I said, these pressure ulcers are caused by mobility. And some of the causes for the pressure are other causes for pressure ulcers are friction and shearing forces. So these are also responsible for causing pressure ulcers. And for these, there's if there's too much friction or too much like shearing forces that are being brought upon those bony prominences, that's when those pressure ulcers will begin to appear. Some of the risk factors include just older age, just because skin is not going to be as strong as that of younger patients. Infection as well, infections. Incontinence is another risk factor. Low blood pressure, and malnutrition as well. And another cause for these pressure ulcers could be excessive skin moisturization. And this could be an issue due to the epidermis being thinner than usual if there's too much moisture on the skin. And that causes the skin to break down and break down a little bit easier. Leading for there to be more pressure ulcers on different parts of the body. Some of the interventions that can be done to prevent pressure ulcers include just patient education. So just letting them know that there should be a change of position if bedridden, or if needing to be in bed for days. So just continuously moving throughout the hours, improving nutrition as well. So just ensuring that we have the proper nutrition, we're eating the correct foods, proper wound care, and moisture management. Special mattresses as well. So there's air mattresses that patients can be placed on in order to not have as stiff of a mattress. So that also relieves additional pressure on the high-risk areas of the body. And then also for bathing purposes, using a sponge or cloth when washing the affected areas. Pressure ulcers can also occur while a patient is in a wheelchair for prolonged periods of time. So proper wheelchair management, proper positioning and height of the wheelchair, that's also important in order to prevent these pressure ulcers.